So why did I start Garner? Well, I actually started off by having some health issues myself. I had repeated back pain and I got the wrong diagnosis repeatedly. I've had 4 surgeries and I've really bounced around the healthcare system. So I've seen it from the inside and I'm passionate about fixing it. I'm originally an economist and investor, and I got to see from the data the impact of our broken healthcare system on the entire country, and particularly on the middle class, who really hasn't gotten a wage increase in 30 years, and what they've gotten is more and more expensive healthcare benefits, which haven't created any better health outcomes for them. Even now, the average American family doesn't have enough cash on hand to pay for their deductible bill. So they're actually functionally uninsured, and yet their employer pays $12,000 a year, which really could be going into their pocket. I started off thinking, one great place to solve this is by being a health insurance company. So I helped get a startup health insurance company off the ground. So we were managing about 1 million members and starting to look at the data for these members. And what we started to see, regardless of the disease of the patient, their age, whatever it was, one thing mattered more than anything else in determining the cost and the health outcomes of that member. That is which individual doctor a patient saw. So up until now, most people have made their healthcare decisions based on the hospital or hospital system. It turns out that even within the most prestigious hospitals in the country, you still see massive variation in doctor quality. And you go on one side of the hallway, you see Dr. Smith, and you get really high quality outcomes, really great treatment, and you're right back to work. And you go right across the hallway to Dr. Jones, and it's an adventure with misdiagnoses, revision surgeries, complications, and the like. As a health plan, I went to go negotiate with the hospital system that they would both work at. And I would say, hey, Dr. Smith is great, but we have some pretty clear data that Dr. Jones may not be the best. And the response I repeatedly got time and time again was, we love what you're doing, but honestly, we've also looked at the data, and unfortunately, Dr. Jones is one of our highest revenue doctors. So if you want to work with us, with anybody in our hospital system, and if you want any of our doctors in your network, you have to treat them exactly the same in your network, in your search results, and everything like it. Frankly, I got frustrated, and that's when I started Garner. And the idea of Garner was, how do we get the information around doctor quality, but really make it impactful? So what we've done is we've aggregated 3/4 of the claims data in the country, and we analyze it in a really different way to understand doctor performance. We put that in a great member experience where employees can get information they've never had before about who are the best doctors for them. And then finally, we really change the economics of healthcare, where employees can get richer benefits if they engage with Garner and use the tools. And changing those financial flows are really key to changing the system. What we've started to see is, number one, employees and members use this a ton. So we have engagement rates that are significantly better than the industry average. We've started to actually have calls from providers to say, hey, I've heard about your data. Could I have it to refer to better doctors for my patients? Or I've been losing some patient volume. Can I actually use the tool to improve my own performance? And so that's really the vision of Garner, is to create this virtuous cycle which leads to higher quality care and lower cost over time for everyone.